Have you not been feeling like yourself lately? Maybe you feel like you have increased irritability, fatigue, you're gaining weight out of nowhere, your hair's thinning or falling out, you got acne out of nowhere, you're getting more headaches. Could all these be from one thing? Many people with these and many other symptoms attribute them to being all hormonal issues. They may be right, but the key to giving these symptoms that one attribute is their relevance. In other words, do the symptoms fit together coherently with the broader picture of what's going on with your health? Do they create the picture we call hormonal imbalance? In this video, we're going to explore this concept in more detail. Hi, my name is Dr. Terranella, and in our practice, our goal is always to find and treat the cause. Many times, hormonal imbalance is that cause. So in this video, I'm going to share with you some common hormonal imbalance symptom patterns that correspond to hormones that are out of balance. So let's take a look. So remember, it's the hormone levels that affect your symptoms, that give you the symptoms or the absence of symptoms. Sometimes symptoms alone can be misleading, as many hormones have similar effects on the body or give similar symptoms when they're not in sufficient levels. So depending on which symptoms you're more concerned about or most concerned about, you may be misled by simply looking up, one symptom on the internet or somewhere. So the point here will be to show how easy it is to be misled, and hopefully you'll remember when trying to find the cause of your health issues to stay open-minded to what the possibilities could be of what's wrong. And from that place, the problem, when you're staying open-minded, the problem should actually reveal itself. When you're continuing to search and keep an open mind, you'll be able to link up to the actual source or sources if there are multiple. So I'm going to compare some symptoms of low thyroid output, also known as hypothyroid, and we're going to also look at low adrenal output or low cortisol output and compare the two. And so first I'm just going to read the symptoms of one of them, and I'd like you to try to guess, see if you can pick out the symptom pattern that matches which. Okay, so first one is, the first list of symptoms is fatigue, weight fluctuations, lightheadedness, irregular heartbeat, feeling more cold, increased thirst, and urinary frequency. So you have to match which one that goes with. And then the second list is rough, dry skin, depression and or fatigue, weight gain, lightheadedness, irregular heartbeat, constipation, increased cold, or cold intolerance rather, excessive thirst, hair loss, and urinary frequency. So how did you do? There are a lot of overlapping symptoms between these two. The first one I read is for adrenals, and the second one I read was for the thyroid. Now, I intentionally made some of these terms similar in nature, but symptoms are just, how you're feeling in certain ways. So it's sort of up to you how to describe, how those things feel in your body. So I did go ahead and star some of the ones that I thought were more pertinent to the actual hormone gland. The symptoms that are more attributed to low output in that gland, just to sort of paint a slightly different picture after revealing it. But you can see like both have fatigue and both have brain fog. Okay, so you can see here that a lot of these do overlap. So fatigue, but with thyroid, you may have a little bit of brain fog, and you probably, be feeling a little bit more cold than you would with the adrenal issues. You may have a little bit more brain fog with low adrenal output than with thyroid, although you could have that with thyroid too. Weight fluctuations, those may be more common with adrenal issues. you're not going to have as much necessarily much as weight gain as you would with thyroid, but you certainly can have some fluctuations, and that's where you see also increased thirst and urinary frequency and lightheaded. All those go along with cortisol output being a little bit lower. So then you're going to have less circulating cortisol is going to mean less retention of sodium and chloride, which means the water's going to be flowing out more with your urine, so you're going to urinate more. Now that can happen a little bit with the thyroid too, but not as much. And so with thyroid, you see more of the hair loss, brittle nails, things like that. Constipation is also a little bit more of a thyroid symptom. So you get the picture here. There's things that are a little bit more, symptoms that stand out a little bit more for the thyroid, whereas with the adrenals, you don't see as much of the weight gain and constipation. The two things that sort of stand out are the lightheadedness, or just feeling like you need to sit down, especially getting lightheaded from sitting to standing because of the fluid issues. And then also exercise intolerance, which, for the fatigue, that's kind of when you're going to see that a little bit more, maybe not as much exercise output, or ability to exercise for as long duration. So as you can see, it's not always obvious from symptoms alone what hormone levels are actually off. This is where clinical insight from a doctor and labs come into play. Sometimes, for instance, we may be able to pinpoint more easily what hormone levels may be off based on family history or some of the specific symptoms that we went over previously. But if you're just reading a list of symptoms, it may be hard to identify which hormones are actually off. So I hope this video was helpful in understanding how hormone imbalance symptoms can be misleading in general. However, when applied to specific glands, it can actually be really helpful in determining which hormones are out of balance with the entire system of the body. So keep in mind this video was focused more on how symptoms of hormone imbalance can have overlapping manifestations, rather than we didn't really focus on any particular hormone disorder. We didn't explore, for instance, when cortisol is high and when thyroid is high. So there's a lot more details that could have been explored in a video like this, and I will be posting more videos on similar health topics, similar related things very soon. So if you like this video, please hit the like button, and if you want to be notified when the next video is out, click on the subscribe to the channel to be notified, and we'll see you next time.